Hello, Dr. Caroline. It's very nice to see you after so long. Can you introduce yourself to our friends who do not know you yet?
Sure. My name is Dr. Caroline Zabiegaj-Zwick. I am a pediatric surgeon and I've been in the beautiful kingdom of Cambodia for just under a year and a half. It will be a year and a half in June.
Wow, that's great. Thank you again for joining us. We are very grateful and happy to have you here today to talk about this interesting topic, which is pediatric surgery, children's surgery. Very often when we hear about surgery, and even especially for children, they may have a feeling of fear and anxiety when they have to go to do surgery. Even for parents, the experience may be scary or very worrying.
Yeah, indeed. I think as a parent, taking your child to the doctor if they're ill is daunting and scary for both the parents and the child. And if a child needs surgery, that makes it an even scarier experience. I'm a mother of 2 children myself, so I know all the emotions and the feelings that arise when your children are sick, when you have to take them to the doctor, and as well as the fear and the uncertainty that comes with reaching out to healthcare providers when your children are sick.
Oh, that's very interesting. You have more than 10 years of experience. Can you tell us over these years, how did you help to look after the children, and especially how did you help to better prepare them for their surgeries?
Sure. Well, as you've mentioned, I've been working with children for over a decade. That's a long time. And I do so with humility, a lot of laughter, and a lot of fun. This is actually just to help alleviate stress that comes with the operations and to help the children feel comfortable. So as I mentioned before, going to surgery can be a very scary experience, but it actually need not be so bad. The journey starts with a visit to our very fun and colorful pediatrics room. There's toys, there's colorful things for the little ones to explore. And after taking a history, I will examine the children in a fun manner. And sometimes this will mean examining mom or dad first so that the children see that an examination is not painful. Sometimes I use toys. It all depends on the child. And the most important thing is that my care is tailor-made to the child so that the child and the parents can feel comfortable with me. It's important to me that people understand what will happen and the steps that they will follow. So during any of my consultations, I tend to use a lot of drawings to explain medical conditions, to explain operations. I give online references that I myself have vetted, and so that the parents can read more about what to expect on the internet. And if the child is old enough, I even involve them in a simple manner and explain to them what is going to happen and what needs to happen and the steps that they'll need to follow until the end of the journey.
Oh, I'm sure this is very, very helpful to know more about the medical conditions that require the surgery, and also knowing more about the operation procedures. It helps to clear any confusion and gives better understanding to both the children and the parents. So this is before the surgery days. Can you tell us now about the big day, the day of the surgery, and also the days that follow the surgery?
Sure. So as I mentioned, it's important for people to know what to expect. But the other thing that's important is that I am with the child every step of the way on the journey, from the beginning until after the surgery and the aftercare as well. So there's always a friendly face that people can turn to. The day of surgery is usually the scariest day. It's the most frightening day, but we try to make it as easy as possible. We have well-trained staff in pediatrics, in the wards, in theatre. We try to do our surgeries very early so that little ones don't have to be hungry, because that does make them quite anxious and it makes parents anxious as well. And we sing a lot and we have fun along the way. So it's actually not unusual to hear nursery rhymes or songs being sung in the pediatric theatre. It's fairly standard routine things to do, actually. The aftercare again is filled with fun. And I involve the parents every step of the way in the journey, because if mom and dad are comfortable, then the child is also comfortable and everyone just feels so much better.
Parents do also play an important role in the whole process. Thank you, Doctor, for sharing these insights from your experience. Unfortunately, we are already nearing the end. And is there a final word that you would like to share?
Yes, so I believe that as a doctor who deals with children, one of my tasks is to show that children that hospitals are not scary. Doctors and nurses are amazing people, because as those children grow into adulthood, they still need to continue to seek medical care for when they're ill, for their checkups, and they mustn't neglect their medical care out of fear because of a bad experience in early childhood.
That's a great message. Thank you very much, Doctor, for taking time to talk to us today. And let's continue to stay safe from COVID-19.
Thank you very much. Stay safe.